Kenzie and I are going to show you 3 common causes of pain that occurs in the back of the knee and then how you can treat them at home. So the first condition is going to be a Baker's cyst that occurs behind the knee, also known as a popliteal cyst. So sometimes these can occur because of an injury. You had a meniscal tear or some cartilage tearing, or maybe you've twisted your knee, or there's a whole different list of conditions that can cause this. So you've got that spot behind the knee that kind of fills up with fluid. Sometimes it fills up and it goes down. It may go back and forth. So your doctor's told you just go home, do some range of motion type stuff, put moist heat on it or whatever you like, and then just kind of start working the area. So we're going to show you 3 things that you can do for this area. Number 1 we're going to start with is just a calf stretch. Now you can use one of these stretch straps, or you can use a towel or a sheet, whatever you have at home. And Kenzie's just pulling back, stretching the calf, the back of the leg. And then what she's going to do is raise her leg up off of the mat just a little bit. So I've got a little space here, and just hold that just to try to stretch a little bit because the calf muscle crosses behind the knee joint, and so does the hamstring complex back there. And so just trying to stretch that out to take some pressure off the back of the knee. And now to improve range of motion, this is going to be a heel slide that's assisted using the same strap again, or maybe a sheet or a towel. So Kenzie's just bending her knee up as far as she can go there. That may be painful behind there. She may not be able to go this far. Just progressively work to go on more and more as you can. And she's going to repeat somewhere between 2 sets, maybe for 15 repetitions, and do that a few times a day. The last thing we're going to do is a strengthening exercise. This is a pretty low impact, non-strenuous exercise, especially if your knee's pretty painful. It'll be difficult to stand and do some things. So I have her in long sitting position here. So you can do this on your bed or your couch or wherever. And what she's going to do is tighten up her thigh, and then she's going to bring her leg up and pull her foot and toes back up to her at the same time. And just try to raise that off of the surface here, the mat, bed, couch, whatever you have there, maybe 5-10 inches. She's going to bring that up, hold it. Maybe she holds it for somewhere between 3 to maybe even working up towards 10 seconds. And she'll repeat that for maybe 10 to 15 repetitions, a couple of sets, and then perform that just throughout the day whenever she can. The second condition is going to be hamstring tendonitis, which is most commonly the bicep femoris muscle that's involved. So what Kenzie's going to do is just, again, that static stretch, just like she did previously on that Baker's cyst, where she's pulling her leg up off the mat a little bit, pulling her toes back, and she's going to hold that, and she'll hold that stretch somewhere between 10 to 20 seconds, and just repeat that several times and do that several times a day. Don't be too aggressive with this because, again, this area is going to be inflamed and irritated with that tendons inflamed, so you just want to kind of be easy with it and progress up to a little more strenuous stretching. And now we're going to start with a range of motion and strengthening exercise, and she's just doing heel slides here. You've seen this previously where she was using a strap. If you can't do this on your own, you can use a strap to help kind of pull your leg back. This is just a low impact, simple technique that you can do. You can also just do this in your sock so that it slides a little better. I've had patients put pillowcases or towels under their feet so it slides better. If you're going to do it maybe down the floor or something like that, where you get that range of motion that's a little easier. And lastly, we're going to do a strengthening exercise, hip extension. So you're going to go on your stomach, and Kenzie, we're going to say this is her right leg since she's just flipped over for the camera. She's going to bring her right leg up, keeping her knee straight if she can. If she can't keep her knee straight initially, she can do it with her knee bent a little bit. You can do this with it bent, and that's okay. And then work on getting it down flat and straighten it all the way. She's going to bring that up, hold that somewhere between maybe 3 to 5 seconds, and then bring it back down. And she'll repeat that somewhere between 2 sets to 3 sets of 10 to 15 repetitions a few times a day. The third condition is going to be a meniscus tear that's non-operative, or you've elected not to have an operation on it, because there's research that supports in a lot of cases the meniscus doesn't always have to be operated on. You can do conservative strengthening and range of motion exercises to restore that normal movement for standing, walking, and then functional use. So Kenzie's going to do the same stretching exercise. She's going to hold it here, again, the same time frame as before. Maybe she can only hold it 5 seconds at the time. Or maybe she works up to 20 seconds. And she's going to repeat that several times, or set for several repetitions, and then several times a day. But I do like that exercise or that stretch to be done to just stretch that back there, the posterior complex, because that gets tight and it kind of jams and binds up on the knee. The next movement we're going to do is a strengthening exercise. This is a pretty low impact exercise, and again, you'll kind of have to progress with this. You may not be able to straighten your knee out all the way, so if your knee has to stay partially bent throughout this, that's okay. So what she's going to do, we're going to say this is the left knee. She is going to bend her knee up, bring her foot just like this, and she's going to kick her knee out like this and bring her toes and foot back, and then she's just going to reverse that to come back down. And you would repeat that somewhere between 2 to 3 sets for 10 to 15 repetitions. Again, if you can't get your leg up this far and you can't straighten it out all the way, that's fine. Just start and go with what you can at first, and then you can progress from there later on. The last thing we're going to do for the meniscus is a wall squat. So Kenzie's just up against the wall here. She's just going to go down, bend her knees a little bit, come right back up. You don't have to go really deep with this squat. In fact, I advise you not to, especially until you feel comfortable with it and it doesn't hurt too much. You can put a towel behind your back, something to slide on the wall a little better. If you have a wall that you can't really slide up and down on, maybe as far as the texture just doesn't allow it, you can do a wall sit. So she's just going to kind of squat down and then hold that position. So she has her knees bent, her hips bent. How far? I don't really care. I tell my patients just go as far as you can, hold it maybe 3 seconds, upwards of 10 seconds, and then come right back up. And you do that a few times, 2 or 3 repetitions, 2 or 3 sets, a few times a day. At the end of the day, just do it whenever you can, whenever you have time. We hope these tips help for 3 common injuries and issues related to pain associated with the back of the knee. Again, this is not an all-inclusive list. There's a whole bunch of other conditions that you can have, so make sure you talk to your doctor and rule out anything that's more significant going on. Thanks for watching.